Hi, I'm Dr. Daria.
And I'm Dr. Michael. And
welcome to Health Talks.
So today, what are we talking about?
We're going to talk about skin.
Okay.
And we're going to talk about what aging does to our skin.
Absolutely.
So our skin, it's comprised of three layers. It's the epidermis, the dermis, and the subcutis. And in the dermis makes up the bulk of our skin. And in our dermis, we have collagen. And collagen makes up most of the dermis. And collagen is important because it adds to the plumpness of our skin and helps our skin become more resilient.
So what happens to the skin as we age? What's going on?
Well, there's a bunch of things that go on. So our subcutaneous fat, as we age, it diminishes and gets redistributed. And unfortunately, it kind of diminishes in some places that we don't want it to diminish, like our faces. Absolutely. And then it gets added on in places that we don't want it to be added on. So really not fair. But this loss of fat in our face sometimes adds to, skin laxity and sagging. Also, we see as we age with weight fluctuations. So when we gain weight, our skin stretches and becomes, it stretches. And then when we lose weight, sometimes by losing weight, our skin will sag. And unfortunately, as we age, our skin doesn't bounce back like it used to. So that can lead to more sagging of the skin and aging. Our muscle mass decreases too as we age. So that's another, thing that happens.
And that can happen with rapid weight loss too, especially if you're doing a rapid weight loss program and not seeing a registered dietitian who's kind of monitoring how much protein you're getting in.
Yeah.
Exactly.
Very important.
Absolutely.
So, the muscle in our face acts almost like a natural filler.
Yeah.
So when we start to lose some of that muscle, we'll see more age-related skin effects as well.
That's the Ozempic face. If you hear Ozempic face, that's because people are losing too much muscle and not enough fat. So what are some of the other factors that can worsen or accelerate, skin aging?
Well, one that I'm kind of guilty of is sun exposure. And
absolutely,
that's something I love, but I know that, being exposed to the sun, especially prolonged periods of time, can really cause changes in your skin. So sun-induced changes is called photoaging, which is kind of yucky. Like, I feel like my face is photoaged. But what happens is that we get more wrinkles, more dryness.
Right.
Our skin gets more rough.
Right.
And then we see like hyperpigmentation, with sunspots. And we can't forget that, increased sun exposure can increase our risk of cancer as well. So super important for people to go for checks, to check their skin and make sure everything is okay. So what's recommended in this for skin is in the sun is a broad spectrum, a water resistant sunscreen with an SPF of a minimal of 30 and wearing that year round.
Right, absolutely.
Do you have some, Michael, that you might recommend?
Yeah, one of the important things too is, you can actually wear an SPF all year round. And there are some tinting products that you can actually use. And there are a couple that I like. Elastin Hydra Tint is a great one. Isden makes some great products. But really the most important thing is to get an SPF of 30 to 50. I think when they say once you go over 50, it kind of really doesn't make a difference. But you should be wearing that whenever you're in the sun.
Right. And also another, insult to the skin is, of course, smoking. So smoking can affect us in bad ways in many parts of our bodies, and our skin takes a toll as well. So
right, so the smoking actually damages the tiny little blood vessels, the capillaries, so it actually decreases your skin's ability to heal itself, which is also why you hear a lot of plastic surgeons will say, you have to stop smoking in order to have certain types of surgery, and that smoking increases your risk of certain types of surgery. So you really want to avoid smoking if you can. So for postmenopausal women or women who are going through their changes, what is the effect of decreased estrogen on the skin?
I'm glad you asked that. Some of my favorite topics, menopause. So, hormones really are important in skin physiology. There's a lot of estrogen receptors on the skin, and this, estrogen helps keep the skin moist, and it helps keep the skin plump, and it's kind of what we want. It gives you a more youthful appearance. So what we see is when estrogen levels decline, like they do when we're menopausal, we do lose collagen,
Okay.
and we do lose skin thickness.
Yeah.
So we see like a rapid loss, occurs in the first 5 years of menopause, and then the loss rate gets slower, and it's not as dramatic after that. So you see that, definitely can see the changes of more wrinkling and,
Sure.
and thinner skin, which leads us to, does estrogen replacement therapy or hormone replacement therapy, does that help benefit the skin?
Right.
And we do see some benefits of systemic estrogen. So the topical, putting topical doesn't seem to help.
Right.
But systemic taking it, orally or by a patch or by a cream to be absorbed through your system, it can help reduce the age-related loss.
Okay.
It does plump up the skin, and we see less effects on losing collagen.
Right.
But the experts have said that just going on hormone therapy alone for skin effects is kind of not warranted, but it may be an extra benefit for those who need it for other reasons.
Okay.
So all this talk about what happens as we age to our skin, now I want to turn to our expert, and let's talk about how, if we want, we can try to obtain a more youthful appearance and
Sure.
kind of rejuvenate our skin.
Sure. I'd say the first thing is definitely a skincare regimen that's
Yeah.
tailored to your
Yeah.
skin specifically.
Which can be so confusing sometimes, right?
Exactly.
You kind of
And
look at all the products out there.
That's why you need to see a specialist, get onto a skin analysis machine like the Vizia, which we have here, to try and come up with a skincare regimen that's going to work for your skin. But I would say there are both topicals and some mechanical, some treatments that
Yes.
actually can be performed to help with that. So first one from topical is a retinol product. I mean, any retinol is going to increase cell turnover. The old layers are going to be replaced by newer layers. Topical vitamin C, which is excellent. Always important to take oral vitamin C too, but topical vitamin C and vitamin E are going to help your skin actually get healthier as well. But as far as the procedures go, a BBL, a broadband light treatment, which actually helps get rid of the browns and reds and causes collagen formation, fractional resurfacing, like a halo laser.
Do
is
those
also excellent.
bump up that all bumps up collagen?
They're all going to increase collagen production, but also take off that dead layer and help a new skin layer come up to the surface. And then there's other things, microneedling with RF, like Morpheus 8, which is going to increase collagen production, but also cause some skin tightening. We all want some skin tightening as we get older.
Yes, we
so
do.
yes, I mean, it's not quite a mini facelift, but if you get enough Morpheus 8 treatments, you will certainly get enough tightening that is going to bring that up. So that's also very important.
And that's definitely something that I want to learn so much more about.
Absolutely, and we can maybe do that in our next video.
Yeah, so stay tuned.
Terrific.
More on that.
Well, thank you for joining us. I'm Dr. Michael Nusbaum.
Dr. Daria, Klachko, Totten.
And thanks for joining us at
HealthTalks. Thank you.